Welcome back to another episode of Dear Senior. Today, we need to talk about something very important, something that affects almost every one of us as we get older, and it is about blood pressure. Now, you might have already heard the news. The American Heart Association and other medical groups have released new blood pressure guidelines. And let me tell you, these changes are not just numbers on a chart. They affect how doctors see your health, how your medications may be prescribed, and even how you should take care of yourself every single day. So, let's have a calm and honest conversation about what's new, what it really means, and how you can use this knowledge to stay healthier and stronger. Remember, I'm not your doctor, but think of me like a caring friend, sitting with you at the kitchen table, breaking this all down in plain language. What changed in the guidelines? For decades, the standard normal blood pressure reading was 120/80. That was the golden number we all memorized. Anything higher than 140/90 was usually called high blood pressure or hypertension. But now, the medical experts have shifted the lines. According to the new guidelines, high blood pressure is now considered 130/80 or higher. That means a lot more people, millions of seniors in fact, are suddenly being told, you have hypertension. If you're thinking, wait a minute, last year my doctor said I was fine, and now suddenly I'm in the danger zone. You're not alone. Many seniors feel a little shocked, maybe even frustrated by this change. But let's take a closer look at why it happened. Why did they lower the numbers? Doctors and researchers have learned something important over the last 20 years. They've studied thousands of patients. They've tracked strokes, heart attacks, and kidney disease. And what they found is this. Even blood pressure numbers that looked okay before, say, 135/85 still carried more risk than they thought. In simple terms, the damage from high blood pressure begins earlier than we believed. Lowering the guideline means catching problems sooner, so doctors can step in before serious issues happen. It's kind of like fixing a small leak in the roof before it turns into a flood. What this means for you now, here's where it gets personal. With these new guidelines, many seniors who thought they were borderline are now officially in the high blood pressure category. If your blood pressure is between 130/80 and 139/89, you're now considered to have stage 1 hypertension. But here's the good news. In most cases, doctors won't rush to give you more medication right away. Instead, they'll first recommend lifestyle changes. Things like reducing salt, eating more vegetables, getting regular exercise, and yes, managing stress. If your numbers are 140/90 or higher, that's now stage 2 hypertension. At that point, medication is usually part of the conversation because the risk of stroke or heart disease rises quite a bit. Why seniors should pay extra attention? For seniors, blood pressure matters more than almost anything else. Why? Because high blood pressure is known as the silent killer. You don't feel it. You don't notice it. But inside your body, it's quietly straining your heart, stiffening your arteries, and putting extra pressure on your brain and kidneys. This is why strokes and heart problems are so common among older adults. And sadly, many people only realize their pressure was too high after something serious happens. But here's the encouraging part: you can take control. With awareness, regular monitoring, and small daily habits, you can reduce your risks dramatically. The role of home blood pressure monitors. Let me ask you this. When was the last time you checked your blood pressure outside of the doctor's office? If your answer is, only when I go to the clinic, then, my friend, it's time to change that. Home blood pressure monitors are affordable, easy to use, and incredibly helpful. Doctors now recommend that seniors keep track of their numbers at home. Why? Because many people get white coat syndrome. Their pressure spikes at the clinic simply because they feel nervous. By checking at home, in a relaxed setting, you get a more accurate picture of your true blood pressure. And when you bring that log to your doctor, they can make much smarter decisions about your care. Lifestyle choices that really work. Now, You've probably heard the usual advice 100 times. Eat less salt, exercise, lose weight. But let's talk about it in a more practical way. Salt. Cutting back doesn't mean your food has to taste bland. Try seasoning with herbs, lemon juice, or garlic. Movement. You don't have to run marathons. A 20-minute walk after dinner can do wonders. Weight. Even losing just 5 to 10 pounds can make a real difference in lowering blood pressure. Stress. Simple breathing exercises, prayer, or meditation can calm the nervous system. The point is, you don't need to flip your life upside down. Small, steady changes can add up over time. Should seniors be worried about medications? I know many of you are already taking several prescriptions every day. The idea of adding one more pill may feel overwhelming. And yes, medication side effects are real. But remember, your doctor's goal isn't just to hand out pills to protect your heart and brain from something worse. If medication is recommended, don't see it as a punishment. See it as a tool, something working quietly in the background to keep you safer. And always ask questions. If you don't understand why you're being prescribed something, speak up. A good doctor will gladly explain what you can do today. So, let's make this simple. Here are 3 things you can do starting right now. 1. Know your numbers. Check your blood pressure at least a few times a week at home. 2. Talk with your doctor. Ask them how the new guidelines affect you personally. Don't be afraid to have that conversation. 3. Take small steps. Whether it's reducing salt, walking a little more, or finding ways to relax, start with one change and build from there. A final word to dear seniors, I know this all may feel like another scary headline, but let me tell you, knowledge is power. The new blood pressure guidelines are not here to frighten us. They're here to protect us, to give us a chance to live longer, healthier, more independent lives. So, if you've been told you're borderline, don't panic. Don't see it as a label. See it as a signal, a gentle reminder from your body that it needs a little more care. At Dear Senior, we're all about honesty, compassion, and taking practical steps forward. So take this information, talk it over with your doctor, and remember, you're not alone. Every step you take toward better health is a victory.